So I know I've been promising a big video on Sweden and the fact that they didn't lock down and we didn't see the catastrophic numbers that were said we'd see. And this video will include some of that. But what this video is really about is the Imperial College model. Now, this was the model that was used as the most important model for the US and the UK lockdowns, which I'll show here. And I'm going to show how ridiculous this model was, both using Sweden and using other facts within this. I'm going to have a bunch of sources and I've typed out a big long thing that I will attach to this. But this is just going to be a quick, like 10-minute synopsis of what's going on with that. So the first thing I want to do is prove, in fact, that this Imperial College model was actually used to help with the US and UK shutdown. So I went to CNN just because I figure even left-wing people will trust it. The study, which has not been published in a peer-reviewed journal, was released on Monday by London's Imperial College COVID-19 response team, which says it's advising the UK government on its response strategy. The study says it's used modeling that has informed the approach of the British government in recent weeks. On Monday, the government abruptly called on vulnerable and elderly Britons to isolate themselves for 12 weeks and introduced a variety of social distancing and quarantine recommendations. Sir Patrick Vallance, Chief Scientific Advisor to the UK, confirmed Tuesday that the Imperial College study was among those the UK government was looking at. What suppression in that paper tells us is exactly what we're doing, he said. Now, to the US. Also on Monday, President Trump unveiled a 15-day plan to slow new infections in the United States, including more stringent recommendations about staying home and avoiding groups of 10 or more people, among other steps. An author of the study, Imperial College professor Neil Ferguson, that's the head of the study, remember that name, said in an email to CNN on Tuesday that the study was given to the White House Coronavirus Task Force over the weekend in U.S. CDC. Quote, the White House Task Force studied it late Sunday afternoon, CDC yesterday, Ferguson wrote to CNN. To be honest, I don't know how much it influenced the decision-making, but I hear Dr. Birx cited it. We'll be having a much more detailed discussion with the task force tomorrow morning. During a briefing on Monday, White House Coronavirus Response Coordinator Birx said, quote, we have been working on models day and night around the globe. We've been working with groups in the United Kingdom, so we had new information coming out from a model. She did not specify which model she was referring to. But it's clear that they're referencing this Imperial College model. They're saying we referenced a model in the UK. This was the big model used in the UK. So now we have it clear. This model was very important. The question becomes, why choose this model? What did they do? I said from the get-go that we should not allow the government to take our rights away, to crash the economy, unless they answer very specific questions, like what models they're using, what was their threshold for when they felt that they were justified in taking away these rights, how would the taking away of rights be able to save lives, etc. Instead, they didn't do any of that. So the first thing I want to do is look at Dr. Ferguson, who's the head of this Imperial College, and see what his track record's been like on predictions. So from the National Review. Indeed, Ferguson has been wrong so often that some of his fellow modelers call him, quote, the master of disaster. Ferguson was behind the disputed research that sparked the mass culling of 11 million sheep and cattle during the 2001 outbreak of foot and mouth disease. He also predicted that up to 150,000 people could die. There were fewer than 200 deaths. Charlotte Reed, a farmer's neighbor, recalls, quote, I remember the appalling time. Sheep were left starving in the fields near us. Then came the open-air slaughter. The poor animals were panic-stricken. It was one of the worst things I've witnessed, and all based on a model of buts and maybes. In 2002, Ferguson predicted that up to 50,000 people would likely die from exposure to BSE, mad cow disease, in beef. In the UK, there were 177 deaths. In 2005, Ferguson predicted up to 150 million people could be killed from the bird flu. In the end, only 282 people died worldwide from the disease between 2003 and 2009. In 2009, a government estimate based on Ferguson's advice said a reasonable worst-case scenario was the swine flu would kill 65,000 Brits. In the end, it killed 457 people. Last March, Ferguson admitted that his Imperial College model of the COVID-19 disease was based on undocumented 13-year-old computer code that was intended to be used for a feared influenza pandemic rather than coronavirus. Ferguson declined to release his original code so that other scientists could check his results. He only released a heavily revised set of code last week after a 6-week delay. Are you starting to see a pattern? The very person that we relied most heavily on to have these shutdowns, to take away our rights, to give a guaranteed economic collapse, has for decades been predicting, tens of thousands of people will die, millions of people will die, about pandemics that killed hundreds. They did end up killing all sorts of livestock and other things like that based on his faulty predictions. Every single time he massively blows how many people die, and then it falls much short of that. So why would we trust him this time? And why would he refuse to give the exact model he was using so that it could be peer-reviewed and retested? As I read at the beginning of this CNN article, which we'll go back to, you look at the top of it. What's the very first thing that even had CNN saying? The study, which has not been published in a peer-reviewed journal. So what... Isn't it ironic that when we have studies like the Santa Clara study, or we have studies in New York or in Tampa, other places in Florida, that show actually when we do randomized testing, that the mortality rate of the virus considerably drops to below 1%. Yet we're told by these people, oh, those aren't peer-reviewed, so we can't trust them. But those very same people trusted a non-peer-reviewed model in order to default to taking away your rights and collapsing the economy. So now that we know that Ferguson has year after year after year predicted apocalyptic pandemics and been wrong, now we have to just trust him this time. And he won't give people the actual source code so peers can review it. Doesn't that sound interesting? Now, famously, they said that there would be 2.2 million deaths in the US and 500,000 deaths in the UK if we did no mitigation. But the problem with this was it was wrong from the get-go because no one in their right mind, including any government leader or politician, or even just person that I talk to on places like Facebook, Twitter, and real life, no one was suggesting no mitigation. In fact, there is no such thing as no mitigation, as we'll get to later. We were suggesting that we question lockdowns. We question economic collapse for the need to fight this virus. But no one said we shouldn't do things. People suggested everything from education to giving out masks, giving out more test kits, to isolating vulnerable populations in nursing homes, making sure they had more resources, to educating people on washing their hands and social distancing, asking for voluntary social distancing measures, all the way up to enforcing these lockdowns. But no one said, let's do nothing at all for the coronavirus. Let's do nothing. Let's not even tell people how to keep safe from it. That's what their no mitigation scenario was based on. Yet why is it then in such an impossible scenario that no one was suggesting that's the only numbers that were touted from this? It's because they were the worst case numbers. So this is from the American Institute for Economic Research, and I'm going to be citing them a lot, but they're quoting not just themselves, but also other experts. It's worth noting that even at the time of its March 16th public release, the condition of the Imperial College study do nothing scenario was already violated, rendering its assumptions invalid. Most governments had already started to do something by that point, whether it involved public information campaigns about hygiene and social distancing, or event cancellations and the early stages of the lockdown, which began in earnest earlier the week. Voluntary behavioral adaptations also preceded government policies by several weeks, with a measurable uptick in hand washing traceable to at least February and dramatic decline in restaurant reservations during the first 2 weeks of March. When read in this context, Ferguson's decision to hike the extreme death tolls of the do-nothing scenario to the press in mid to late March comes across as irresponsible. And of course, even though we were already doing things to mitigate, and don't be mistaken, when you look at the Imperial College study itself, it talks about varying degrees of mitigation and then suppression. And it says we need suppression, not just mitigation. Mitigation factors it talks about are things like this: hygiene practices, voluntary social distancing, things shutting down sporting events, things that had already occurred. So they are including that in mitigation standards in their own study. So they knew that there was not one area in the world that was doing a do-nothing scenario, yet that's the number they chose to give to the media. And all these politicians and media members said, oh my goodness, 2.2 million could die. In fact, you'd be hard-pressed to find another number in the study that says what current mitigation status in the UK and the US, what the deaths would have looked like as far as that goes. Now, let's go further to what they did with this do-nothing scenario, again from the same source. Indeed, the ICL team played no small role in hyping the projections of its do-nothing scenario. Even at its own report downplayed the likelihood of that outcome in favor of more conservative projections, associated with an array of social distancing policies and suspensions of public gatherings. On March 20th, the Imperial College lead author Neil Ferguson reported that 2.2 million death projection to the New York Times' Nicholas Kristof as the worst-case scenario. When Kristof queried further for a best-case scenario, Ferguson answered about 1.1 million deaths. Now, have you heard this? What we're told was, oh my God, millions of people could die if we don't do these lockdowns. But what they didn't tell you is the very study that suggested that is admitting, even if we do all of the lockdowns, the best case scenario is 1.1 million Americans dying. Now that starts to put into context the cost-benefit analysis. As much as people want to make this to be, oh, you have to trust the experts, you can't question them, and if you're against this lockdown, then you want people to die. That is erroneous, and it's terrible people that do that are seeking to avoid a real discussion. They want to just propagandize to you. A real discussion says we have to have a cost-benefit. For example, thousands of people die every year, tens of thousands of the flu, or in car wrecks, or of opioid overdoses, all sorts of things. But we don't lock down to prevent those sorts of deaths from happening. As a society, we value freedom and liberty, and we're willing to accept that there is a cost of life that comes with that. I talk about this a lot in my show. For example, we could take automobile accidents way down if we limited the speed limit across the country to 10 miles an hour. But we've made a decision as a society that our quality of life would be drugged down by that so much that it's not worth it, and some loss of life is acceptable. If not, if we do like we would have these government officials and media people say that Biden said the other day, not one lost life is acceptable, then none of us would ever leave the house. By merely leaving your home, you're taking a risk that could endanger your life. So we would say, no, we'll force everyone to stay locked down indefinitely. Clearly, we could see that freedom and personal enjoyment in life and personal convenience and things like that sometimes outweigh a small risk of death or relatively small percentages of people dying. So the fact that even under their best case scenario of shutting down the economy, and who knows how many deaths that will cause through things like suicide, malnutrition, all sorts of overdoses and things like that, not even taking those deaths into account, we could still see that now they're only talking about saving 1.1 million lives. But you didn't hear that, did you? They don't tout that number. Now, further. To illustrate the importance of statistical scrutiny, it helps to look at past epidemics and observe what similar debates tell us about the accuracy of competing epidemiological forecasts. In the late 90s and early 2000s, one such example played out in Great Britain concerning Creutzfeldt-Jakob syndrome, better known as mad cow. Now, this is further going to speak to exactly what Mr. Ferguson, Neil Ferguson, again, the leader of this Imperial College study, what his background is. In 2001, the New York Times ran a story on different epidemiological projections about the spread of mad cow disease, highlighting two competing models. The first model came from a team of Jerome Holliard D'Agino, Simon Cousins, and Peter Smith at the London School of Hygiene and Tropical Medicine, using a variety of assumptions about the disease's existing prevalence, some in the hotly contested, as well as observational data about the disease incidence prior to the highly publicized 96 outbreak. Their model offered a variety of scenarios depicting an overall mild transmission pattern. As Cousins told the Times in 2001, no model came up with a number exceeding 10,000 deaths, and most were far lower. An estimated 177 people died of mad cow disease in the UK in the wake of the 96 outbreak. When the 2001 Times story ran, however, a different model dominated the headlines about mad cow, one that projected wide-scale pandemic leading over to 136,000 deaths in the UK. The British government relied on this competing model for its policy response, slaughtering an estimated 4 million cows in the process. The competing model did not stop at cattle either. In an additional study, they examined the disease's potential to run rampant among sheep. In the event of lamb-to-human transmission, the modelers offered a worst-case scenario of 150,000 human deaths, which they had hyped to a frenzied press at the time. In the 2001 Times article, the lead author of this most alarmist projection responded comparatively tiny death toll projections from the other model. Such numbers, he insisted, were unjustifiably optimistic. He laid out a litany of problems with the other model, describing its assumptions about earlier mad cow disease exposure as extremely naive, and suggesting that it missed widespread unreporting of disease by farmers and veterinarians who did not understand what was happening to their animals. He conceded at the time that he had since revised the 136,000 projection only very slightly downward, but expressed confidence it would prove much closer to the actual count. The lead author of the extreme mad cow and mad lamb disease fatality projections in early 2000s is a familiar name, Neil Ferguson. Now, here's the guy. We are told constantly, oh, you can't use common sense. You can't ask questions. You just have to trust these experts. Why would we trust an expert that's been wrong every single time? You might say, I'd rather trust a mechanic about my car than look at it myself. But if you take your car to the mechanic 10 times in a row, and every time they say, oh, we got to fix this and it's going to cost $10,000, and it's wrong, why would you continue to trust that mechanic? The same's true here. Just because he's considered a doctor, his predictions have been wrong every single time that's been one of these major catastrophes have been suggested. So it just goes to show once more why just accepting these models and not asking questions was a terrible thing to do. And remember, what people like me were suggesting was that they prove their case before they take away our rights and collapse our economy. They didn't do that. Not only were they non-transparent about exactly what models they were using, what their threshold was, etc., it turns out the models they were using, once we look at the data and look at the people behind it, were horribly wrong. Now, moving on. Now, let's talk again about this worst case scenario. We talked about how the no mitigation, the do nothing approach was non-existent. Yet that's still the fear-mongering number they push. Why? Because 2.2 million dead. That's as bad as it could possibly get. And of course, they undersold and if we do everything, only 1.1 million people, or still 1.1 million will die. So you hype up the fear-mongering and you downplay the fact that you're still, even under your solution, saying that 1.1 million people will die. By the way, what's that prediction now? Now he's changed his mind and he said, we're talking 80, 90,000. So how was he so wrong when he quoted to the New York Times, it's the best case scenario is 1.1 million? A month later, it's become readily apparent the 2.2 million death projection was off by several orders of magnitude, as it was the UK counterpart of 500,000 projected deaths. Ferguson and the Imperial College team shifted their public commentary to emphasize other scenarios with more conservative projections in the tens of thousands. In some cases, this was misleadingly depicted as a revision to their model, although it actually used milder scenarios from their paper. Nonetheless, the damage from the overhyped do-nothing scenario was already done. Instead, as of this writing, President Trump is still citing the 2.2 million projection in his daily press conferences as the underlying rationale for the lockdowns. The New York Times COVID reporter, Donald McNeil, who is also still touting the same numbers as recently as April 18th, and even a month later, it remains something of a social media taboo for non-epidemiologists to scrutinize the underlying statistical claims of the credentialed experts like Ferguson. Stay in your own lane, we're told, and let the experts do their work. Epidemiology has its own proprietary methods and models, even as their most alarmist scenarios, the ones that Ferguson publicly hyped to the media a month ago, falter in visible and obvious ways. Enter the NBER paper, jointly authored by a team of health economists from Harvard University and MIT. Its authors conduct a measured and tactful scrutiny of the leading epidemiological forecasts, including the Imperial College model at the heart of the lockdown decision. Among their findings, quote, "The most important and challenging heterogeneity in practice is that individual behavior varies over time. In particular, the spread of the disease likely induces individuals to make private decisions to limit contacts with other people. Thus, estimates from scenarios that assumed unchecked exponential spread of the disease, such as those reported figures from the Imperial College model of 500,000 in the UK and 2.2 million dead in the United States, do not correspond to the behavioral responses one expects in practice." Now, this is jargonistic, but what it's saying is this. When something like a virus comes along, people inherently adapt, whether it be government action or even without that, just you as private individuals. You're going to change your behavior. So if you see that there's an epidemic that's killing tens of thousands of people, you're going to voluntarily social distance. You're going to have better hygiene practices. You might be doing things like purchasing masks. You might be doing things like avoiding places like stadiums that you think could have an easier spot to transmit this disease. All of those are mitigation scenarios. Now, epidemiologists know this, and so would have Neil Ferguson and those at the Imperial College. This means that the, quote, do-nothing scenario is literally impossible. You would have to brainwash people to not look out for their own interest and totally ignore tens of thousands, hundreds of thousands of people dying and not changing their behavior. As the Imperial College admits, things like refusing to go to sporting events, self-isolating, etc. are all considered mitigation steps, which they factor in as then lowering the projected death toll. So why are they pushing the 2.2 million people dead number that they know is a physical impossibility? Not to mention, in the past article, I just showed you how the United States and the UK already had taken governmental positions to mitigate. So the number was a lie. The paper concludes, quote, "In sum, the language of these papers suggests a degree of certainty that is simply not justified. Even if the parameter values are representative of the wide range of cases within the context of the given model, none of these authors attempts to quantify uncertainty about the validity of their broader modeling choices." In other words, these epidemiologists pushing forth this model know that they can't be certain, yet they go off as if they are certain. So what all this shows is the number that was pushed as fear-mongering that's still cited by Trump, that's still being used by people in the UK to justify these lockdowns, that number was never realistic in the first place. Why would they choose that number? Why wouldn't they rely on actual hard science? Why choose an imaginary number that's literally impossible to get to, based on their own study? It's because it wasn't about the truth. It wasn't about keeping you safe. It was about instilling fear so that they could have control over you. That's what it was about. Now, this is the actual Imperial College study itself. And what's important here is I want to focus on where they got their data. Now, I've been told often that we can't use the New York Times study, the Santa Clara study, the Florida study, studies in places like Germany and Sweden, all of which show that when they do randomized testing, that actually the mortality rate collapses. And the theory is this. Right now, we're told that the mortality rate's over 5% in the United States. But that's because the only people we're testing are people with symptoms. When we randomly test and test people that aren't going to the hospital to get checked to see if they have COVID, it turns out that that number increases dramatically. With every increase in infected people, it is directly proportional to a decrease in the mortality rate of the disease. Here's a simple way to look at it. Say 100 people have COVID and 10 died of it. That means that the mortality rate is 10%. But let's say those same 10 people still died, but we've now found out that 900 other people had the disease but didn't show symptoms. So now the totality of people that had the coronavirus were 1,000 people, and only 10 died. That means that the mortality rate is 1% and not 10%. Now, I've discussed before, if we have a disease that's highly infectious with a low mortality rate, then having a lockdown is irrelevant. It's going to spread anyways. Just yesterday, we saw that New York, Cuomo admitted that over 60% of new COVID cases they see are from people that were locked down in their homes, not people that were essential workers. And over 60% of those people said that they didn't even leave the house. So it shows that this is spreading anyways. The lockdown was worthless. This is further showed by places like Sweden, South Dakota, and other places where the curves all look pretty much the same everywhere we go. Now we risk a, quote, second wave as people that were locked down and weren't exposed could possibly be exposed in the future. Nonetheless, we could see that these numbers were hyped and exaggerated. So why is it that we can't trust these studies like the Santa Clara and all these other studies that show every single time we test random populations that the mortality rate's way lower? Well, one, because people say these aren't truly random. And that's true. It's almost impossible to get a true random sampling. But they're far more random than the numbers we currently have. And so they should be trusted more than the numbers we currently have. Because now, not only is it not random, but we're exclusively testing people who are showing symptoms of possibly having the virus. But secondly, where is the data coming from that this model, the Imperial College model, was used? Not only did it use non-random testing to make their predictions, it used data from countries like Italy and China. So this is from the Imperial College study itself. Let's see what it says. Disentangling the relative effectiveness of different interventions from the experience of countries to date is challenging because many have implemented multiple or all of these measures with varying degrees of success. Through the hospitalization of all cases, not just those requiring hospital care, China, in effect, initiated a form of case isolation, reducing onward transmission from cases in the household and in other settings. At the same time, by implementing population-wide social distancing, the opportunity for onward transmission in all locations was rapidly reduced. Several studies have estimated that these interventions reduced R below 1 to the 15th power. In recent days, these measures have begun to be relaxed. Close monitoring of the situation in China in the coming weeks will therefore help to inform strategies in other countries. So one, we have the Imperial College touting the Chinese model, when sick people just disappeared, where they beat people that were ill and threw them in the back of vans, where they allegedly welded people in their homes. Yeah, they did. Those types of policies are good, says the Imperial College. And second, they're using the numbers coming out of China saying, oh, this was a success. the rate of infected went down. The rate of deaths went down with China's policy. But almost every credible outlet at this point is admitting that China massively underreported their numbers. So if this study is based on the data coming out of China, and we now know that the data coming out of China was intentionally skewed, how could this model be accurate? Now, they'll say, when we get to Sweden here in a minute, oh, you can't use Sweden's, and that's apples to oranges. But we could use a model relying on Italy and China? Now, another thing that I've been talking about that's a problem with this model, remember, what they didn't tell you was they acted like, hey, if we just do this lockdown, then we're going to save all these lives. Only 60,000 will die. Well, according to the model that they used, it said 1.1 million would still die. So they didn't tell you that. And the other thing they didn't tell you was, what will the cost be of initiating these lockdowns? How long will the lockdowns be? If they go on for so long, what will it do to our food supply? What will it do to people's mental health? What will it do to people's livelihoods, etc.? We were fed this line that any day we could open up. Trump said it could be by Easter. No one gave us a specific outlook. They just said, oh, these models will work, or they said these restrictions and lockdowns will work, and they cited things like the Imperial College to prove it. So let's see exactly what the Imperial College best case scenario for having as few deaths as possible, what they actually recommend. You ready? Quote, the major challenge of suppression is that this type of intensive intervention package, or something equivalently effective at reducing transmission, will need to be maintained until a vaccine becomes available, potentially 18 months or more, given that we predict that transmission will quickly rebound if interventions are relaxed. In other words, if we don't lock down until a vaccine, which could be over 18 months, then we might as well not have locked down at all. Now, is that the rosy picture that the media and that these governments have sold you when they took away your rights and collapsed the economy? Did they tell you, look, even if we do this, 1.1 million people are still going to die? And by the way, we're going to have to be locked down for 18 months. If not, then the lockdown was worthless. If we only stayed locked down for 10 months, all we did was destroy the economy, and the exact same amount of people, or a similar amount, will end up passing away. Again, more lies and a lack of transparency to you. How many people would have stood for a lockdown and the taking of their rights if they were told up front it could be up to 18 months? Now, this is in addition to we see studies like New York that I just showed you that the lockdown's not being effective. More than 60% of people in New York City that are getting the coronavirus are embracing the lockdown. It's addition to the fact that we see that they're now estimating 9 million people around the world could starve as a result of this lockdown. 1.5 million more people could get tuberculosis around the world because of lockdowns. Suicide numbers will go up. Also, malnutrition deaths from that will go up. People that were unable to get vaccinated for other illnesses will go up because they couldn't go to the doctor. All sorts of things. But we were just told, no. If you don't trust us, if you don't trust these models, then lives will be expended. Now, the final thing, and this is the part that I've been touting for a while, is Sweden. And I want to talk exactly about what's going on with Sweden and how it disproves these models. So, from a different article from the American Institute for Research. Let's begin. This is kind of long-winded, so I'll pause to explain things when necessary. Although the Imperial College model's main paper has been out for over a month, an odd series of missteps continue to hamper external scrutiny of its predictive claims. In an unusual break from peer review conventions, the Imperial College team delayed releasing the source code for their model for over a month after their predictions. They finally released the code on April 27, 2020. Though the popular code and data sharing website GitHub, but with the unusual caveat that its parameter files are provided as a sample only and do not necessarily reflect the runs used in the published papers. So in other words, they hid their code. What the source code is, it's kind of like their algorithm that they put in, that they'll be able to put in the data they're receiving from countries like China, Italy, put it into this kind of code, and then it'll churn out their predictive numbers. They didn't release exactly what that code was. So not only did we rely on this without it being peer reviewed, we relied on, again, why is the default to take away our rights and collapse the economy? You would think that before you do something like that, you would have to have almost certainty that it was worthwhile. But instead, it's just the opposite here. We had a guy who has a track record of being wrong every single time by saying, it's an apocalyptic virus, and then only a couple hundred people die. But we trusted him without any proof, with them hiding the source code, without it being peer-reviewed. We trusted them implicitly, and we did the lockdown that they were suggesting. Why is that? Again, I've said over and over that the biggest danger, even more than the economy, which is a huge danger to our country, the biggest danger is we have set the precedent that the government could shut down our rights and shut down our economy anytime they want based on any fear-mongering. If a guy who's fear-mongered for 20 years and been wrong all these times about pandemics, if his fear-mongering's enough to get us to give up our rights, then what fear-mongering won't be? Next, it'll be climate change, mark my words. So they didn't give out the code until 6 weeks later. And even then, the code wasn't the exact code that they used. So we continue. Put another way, they released a heavily organized and generic file that would permit others to run their own version of the COVID model. They do not appear to have released the actual version they ran in the March 16th paper that shaped the US and UK government policies, or the results that came from that model, a distinction that was immediately noticed by other GitHub users, prompting renewed calls to release the initial code. Now again, what has my statement been from the get-go, and even at the beginning of this video? They're intentionally not being transparent so they could say, whatever the outcome is, see, we were right. If they give all the data, if they gave the models, if they gave their threshold, if they gave the source code, it would enable people to check and see if they were correct in taking away our rights. Instead, they hide that, so no matter what, they could say, oh, no, we revised our models because we were still right, though. As of this writing, the data needed to fully, and I believe this is, let's check the date real quick, just some, April 30th, that's what I thought. As of this writing, the data needed to fully scrutinize the model, and results behind the March 16th Imperial College paper remains elusive. There may be another way, though, to see how the Imperial College COVID model projections are performing under pressure. In late March and early April, much of the world's attention turned to the case of Sweden, after its government broke from the lockdown policies being implemented by most other developed world governments. Sweden earned praise early on for keeping its restaurant and businesses open, albeit under moderate social distancing guidelines, in an effort to build up herd immunity rather than delay the disease until a vaccine's developed. Yet by mid-April, its alternative strategy came under a barrage of criticisms by epidemiologists, pundits, and even President Trump, who blamed the uptick in COVID-related deaths in Sweden on its failure to impose a lockdown policy similar to the rest of Europe. The latest numbers from Sweden contain several hints that it's flattened the curve and its death rate per capita is consistent with or below most other Western European nations, although also higher than its neighbor Denmark and Sweden. It will likely take many months before we can say for certain how Sweden's strategy played out, but at the least of this writing, panic failures of 2 weeks ago have not come to pass. That's where an interesting twist on the ICL model comes into play. Although the ICL only released scenarios and associated forecasts for the United Kingdom and the United States, its model is theoretically adaptable to any country by changing the inputs to reflect its population demographics and the date specific policies took effect. Now pause here. I've been saying the whole time, the reason we know these catastrophic predictions were wrong is that actually Sweden, that didn't do the lockdowns, didn't see the catastrophic number of deaths that were claimed we would see without lockdowns. Now, what the lockdown purveyors want to do is say, yes, but Sweden's a different country, so we can't compare it. Yet they're citing models that were dependent on China and Italy. And not to mention, it wasn't just as if they said, well, if we don't do the lockdowns, then, we could save 2 to 3 times as many people. They said in the UK specifically that if we don't do the lockdowns, 500,000 will die. If we do the lockdowns, only 20,000 will die. That means 25 times as many people will die if we don't do the lockdowns. That's what they said. Now, granted, that was their no mitigation scenario, but that's the numbers they put forth. From 500,000 to 20,000, based just on these lockdown type policies. So that would imply it would be disastrous to not have a lockdown. The magnitude would be immense, and it would by far supersede any difference in demographics and things like that. So I've been saying this for some time. And if you go right now and you check out statistics.com, I think that's the name of it, where you can see the actual numbers, we can see that actually the per capita death rate in the UK is 60% higher than in Sweden. In other words, per 100,000 people, there's a 60% higher chance of dying of COVID per 100,000 people in the UK as there is in Sweden. We would expect that to not only be opposite, but even of a greater magnitude of Sweden being worse. So why isn't that the case? What's the explanation? And no one's been able to give an explanation on that. They just say, oh, the countries are different and you're not an expert. So here we have actual experts at a university that took, as best they could, the actual code and the principles that were used in the Imperial College model, input the data from Sweden, and then were able to make similar predictions. So let's see what the Imperial College model would have predicted for Sweden. In early April, around the peak of the academic community's backlash against the Swedish government strategy, a group of researchers at Uppsala University attempted to do just that. They released an epidemiological model for Sweden that adapted the Imperial College COVID-19 model from Ferguson and his colleagues, and attempted to project the effects of Sweden's unique response on both hospital capacity and total fatalities. The Uppsala team's presentation appears to closely follow the Imperial College approach. They presented a projection for an unmitigated response, also known as the do-nothing scenario, then modeled the predicted effects of a variety of policy intervention. These included staying the course on the government's alternative approach of remaining open with milder social distancing guidelines, as well as implementing varying degrees of a lockdown. The model stretched its own urgency as well. Sweden would have to adopt a lockdown policy similar to the rest of Europe immediately if it wished to avert catastrophe. As the authors explained, under conservative estimates using their model, the current Swedish public health strategy will result in a peak intensive care caseload in May that exceeds pre-pandemic capacity by over 40-fold, with a median mortality of 96,000 people being realized by the end of June. Almost 100,000 dead by the end of June is what they're predicting, if they don't immediately do the lockdown, which they still haven't done the lockdown. And this study was being done in early April. Their proposed mitigation scenarios, which followed lockdown strategies similar to those recommended by the Imperial College paper and adopted elsewhere in Europe, were, quote, predicted to reduce mortality by approximately threefold, while also averting a catastrophic failure of the Swedish healthcare system. The authors of the paper expressed sincere concerns for limiting the damage done by genuinely horrendous disease, and they released their study in a hope that it would be better inform the policy response. Its predictions have already failed to play out, though, and badly failed at that. So they did this study hoping to convince the Swedish government to do a lockdown, because these scientists were seriously worried, based on believing the Imperial College model, that we would see catastrophic numbers in Sweden if there wasn't a lockdown. The government didn't listen to these scientists, and they didn't do the lockdown. And so, did the catastrophe come to pass? The Swedish model laid out its predicted death and hospitalization rates for competing policy scenarios in a series of graphs. According to their projections, shown below in blue, the current Swedish government response, the response that the government actually did, if permitted to continue, would pass 40,000 deaths shortly after May 1st, and continue to rise to almost 100,000 deaths by June, as I said. The most severe of lockdown strategies, so if we did the biggest possible lockdown, that they considered was supposed to cut that number to between 10 and 20,000 by May 1st, while preserving hospital capacity, provided that the Swedish government changed course by April 10th and imposed a policy similar to the rest of Europe. In its most optimistic scenario, the model predicted that this change would reduce total deaths from 96,000 to under 30,000 by the end of June. So let's just focus on, they said 40,000, if Sweden doesn't do the lockdown, 40,000 would die by May 1st. If they did do the lockdown, 10 to 20,000 would be dead by May 1st. So how's the model's projection performing? Sweden's government stayed the course with its milder mitigation strategy. As of April 29th, COVID deaths stand at 2,462. As of today, the number's at like 2,950 something. Now think about this. What that tells you is, these models, if we take the Imperial College model, it said if we don't have a lockdown in Sweden, 40,000 people will be dead by May 1st. Instead, the number's 3,000. More than 13 times wrong. They said if we do the lockdown, the best case scenario is 10 to 20,000 dead, less than 3,000 dead. The exact same model that we're using to justify the lockdowns in the US and the UK. We could literally see, they were hoping that everyone went with the lockdown, because then and if you talk to people that endorse it, they'll tell you They'll say, well, we have no way of knowing if the 2.2 million people would have died in America because thankfully we did the lockdown. And so they've revised their numbers based on the lockdown. So there was no way to know if the fear-mongering was right. Well, there is a way to know because we can see a country that didn't buy into the fear-mongering and it was wrong by a factor of 13 times as many people they predicted would die than actually died. If we followed their best case scenario. Or I'm sorry, no, that's not. That's how many they predicted would die. Even if we followed their best case scenario, they predicted 3 to 6 times more people would die. The model is incredibly wrong. Incredibly. And why should we be surprised? The person leading the model has been wrong every single time that we look at. I can't say that. Maybe he had some that's not being... But time after time, we've seen he predicted tens of thousands or millions of deaths, and we saw hundreds. We've seen him suggest policies that led to millions of cattle and sheep being killed, and it was all irrelevant because only 100-something people died. The toll that takes not only on the animals, but also on the livelihood of the people raising them is immense. Or the people that would be using those animals for meat or for clothing and things like that. Immense costs. So why would we assume he would be right this time? Why would we assume that people that weren't peer-reviewed and that were hiding the source code were correct? Why would we assume that people that were intentionally pushing a no mitigation standard or a do-nothing scenario that no one in the world was suggesting, and that even by the time they did their study was already beyond that, we already are doing some things to mitigate. Why did they push these fear-mongering numbers that they knew would never come true to their own model, the 2.2 million? Why would we expect them to be honest all of a sudden? Why would we expect their model to be accurate if it relied on the Chinese numbers that we now know were being intentionally unreported? All of this. And we were told not only did we have to believe this, we shouldn't even question it. We had to just accept it. The Sweden case is the nail in the coffin. And this is where I want to say something that might upset people. Why is Trump still knocking Sweden? Again, the UK had a massive lockdown. 60% death rate per capita from COVID in the UK with the massive lockdown, with about as strict of a lockdown as you could have, versus Sweden that didn't have the lockdown. And we were told that places like Sweden would be a hellhole and a catastrophe if they didn't lock down. Tens of thousands dead. That was a lie. That was wrong. Still, we're being told, when I presented this evidence to other places, and I'll put my write-up that I did on this that has some information more and the links to all of this. When I presented it, people said things like, I don't like the website that came from. Well, just because the do-nothing scenario couldn't have been plausible, still millions of people could have died. Or, the most common result, just ignore it. Or say, you're not an expert, so I'm not going to listen to you. Isn't it funny? I said from the beginning, this is what would happen. The people saying trust the experts, all of a sudden would be scrutinizing experts that disagreed with them. They'd say, oh, no, that's not peer reviewed. I have a problem with this study in this way or that way. But they'll blindly accept the study that was clearly wrong that said we have to take away people's rights and crush the economy. When did the default become take away rights, crush the economy, ask questions later? It's ridiculous. It's been ridiculous at every state level that had a shutdown. It's ridiculous at the federal level that shut down. It is time to throw this model in the trash heap. It is time to open up. The fear-mongering was wrong. Never forget it. So if you like this video, please like and subscribe. I had fun doing it. I know it was lengthy, but I think there's a lot of good information. If you would rather, I'll have the link below where my write-up is. I think it's just on my Facebook page. Feel free to share that write-up with anyone you want. Please share this video. I'd really appreciate it. It's important that people see how these lies and fear-mongering led to our economy being collapsed, and who knows how much pain we'll go through over the next decade because of that and the loss of our rights, all based on faulty models that we were told we had to believe and couldn't question. So please like and subscribe, share this video, and listen to me. I'll be doing some more videos coming up, so stay tuned for that. YouTube's not always recommending or showing notifications to people, so just check in routinely. I'll be putting more videos up. All right, thank you so much, everyone. I appreciate it, and as always, have a good one.